What is GERD? GERD is gastroesophageal reflux disease. It is commonly known as severe reflux or gastric reflux. Gastric reflux, the main symptom is usually heartburn. Heartburn means you have a burning sensation in your chest, mainly to the center line in this area. Usually there are other symptoms associated with it. For example, gastric pains, bloatedness in the upper stomach, acid taste in the mouth, and frequent burping. So all these point towards the fact that this acidity from the stomach is coming backwards up towards the esophagus and maybe even to the mouth. This is a very common symptom nowadays, and there are various causes for it. The commonest cause for it is number 1, obesity, number 2, stress, and number 3, the dietary habits. Dietary habits include high alcohol intake, heavy smoking, and high acidic food intake, which will include coffee, vinegar, spicy food or chili, and carbonated drinks or gassy drinks. Furthermore, other unhealthy habits like eating large meals makes the reflux worse, and eating late meals very close to the time that you sleep, that causes reflux. When your stomach is full and you lie flat, reflux frequently occurs. And if these bad habits occur over a long period of time, the reflux becomes more numerous and more painful. What are the effects of gastric reflux? Firstly, it can cause redness and swelling of the lower part of your esophagus, or the tube that connects your mouth to the stomach. Secondly, this redness and swelling can eventually develop to ulcers, and over many years it can even become cancer. So that is the cause of a rising rate of cancers in this region where the esophagus joins the stomach. It is easily preventable though. You need to reduce the acidity in your lifestyle. For example, chili, vinegar, carbonated drinks, and coffee, and of course stopping alcohol consumption, smoking, stress, and irregular meals. Do not eat large meals, and do not eat meals late at night just before you fall asleep. If despite all this you still have persistent reflux, try to prop your head up with extra pillows when you go to bed. A gastroscopy or a scope through the mouth looking at the stomach will be useful to look at the esophagus and the stomach to ensure that there are no serious effects of the reflux. Tissue sampling or biopsies will determine how severe the reflux is. Finally, medication to reduce acidity and medication to reduce the amount of reflux fluid can also help with the overall management. To see what the situation is with your body, please consult a doctor as soon as you can if you have these symptoms.